Hey, I'm Thando from Paramount Birth Keeper. I am a birth doula, a postnatal doula, a hypnobirthing teacher, and I teach workshops and courses online and one-to-one throughout London to pregnant women and their birth partners to help them prepare for labour, birth and beyond. In this video, I'm going to be talking about the basic needs of a woman in labour, especially in the current Covid-19 crisis. I'll also be sharing some tips, so if you are pregnant at the moment and about to give birth, hopefully there might be a tip there that could help you. A lot of pregnant women are seeing some changes to their birth preferences. These changes might include their place of birth no longer being available to them, for example, or it could be changes such as the number of birth partners available to them during appointments, during labour and postnatally being restricted. Another consideration that we have to make is the important role that family and friends play postnatally in giving support to new families. With so many people self-isolating at the moment, the support could reduce. So we also need to consider these changes and how it affects women during this crisis. There are two basic needs of a woman in labour: the need for privacy and the need for safety. When we talk about the need for privacy, I think it's really important that we draw upon our knowledge of observing different women in different cultures throughout the world, and also observing mammals, whether they be domesticated or mammals in the wild, and how they give birth. What we know about how they give birth is that they give birth very well most of the time, and that environment is very, very, very important. So in the context of women giving birth during the crisis, regardless of where your choice of birth place is, I think it's really important that as long as it is absolutely safe to you and baby, physically and psychologically, then it's really important that woman stays home for as long as possible. As long as she feels comfortable staying at home is really beneficial during labour, because that is a familiar environment. You know that feeling when you've been out, if you can remember this feeling, when you've been out all day and suddenly you walk through your front door and your bladder is about to burst, because your body knows that it's in a familiar environment. You feel safe there, so your body knows that it can just completely let go and release. So labour works in the same way, because birth is an involuntary physiological response. So the longer that you are able to stay home, and if you're planning on having a home birth, then great, you're home already. But if you're planning on going into hospital, then I think it's really important that you communicate with the hospital staff, with your midwives, so that they can help you to stay at home for as long as possible. The other advantage of being at home for as long as possible during labour is bacteria. You're exposed to your own bacteria, yours and your family's bacteria, or whoever you live with. So that's really important. In hospital, there are a lot of sick people in hospital. You're exposed to different bacteria when you're in hospital. So if you are planning on giving birth in a birth centre or in a labour ward, then it's important that you go to the hospital at the right time. When we consider the need for safety during labour, it's important that we not just talk about physical safety. Yes, of course, we want to minimise the rate of infection. Yes, we want to minimise and we want to contain the spread of the disease. But we also need to think about safety in psychological safety of a woman in labour, emotional safety, spiritual safety, and the mental safety of a woman in labour, so that we can try to reduce the coronavirus related illnesses or trauma or postnatal depression that women might be faced with during this time. What we know about the hormones available during labour is that stress hormones are not beneficial during early or established labour. So stress hormones, also known as catecholamines, I hate pronouncing that word, but I think I'm pronouncing it correctly. They can stop labor sometimes. Stress hormones, these might be caused by different things, such as the fear of the unknown, perhaps, fear of maybe being in hospital if that's not your birthplace of choice, and also, of course, the fear of being alone during appointments or during labor. So we want to try and reduce those stress hormones as much as possible. We know the effects of that stress can have on labor, but also on our immune systems. What we also know about different hormones during labor is that oxytocin, which is the love hormone, it's the bonding hormone that's going to really help you bond with your baby postnatally and every time you breastfeed. We know that it is a shy hormone. So that's why we want to get the oxytocin flowing really well whilst you're at home, so that wherever you give birth, the oxytocin just keeps flowing and that your labor does not stall. So some of the tips that I wanted to share with you if you're about to give birth during this crisis are things like, if I was with a woman during labor at home, maybe as a birth partner or as a doula, then I would make sure that I am writing down the information that's happening during labor, so that this information can be passed on to the midwives who are looking after her. So a lot of trusts are saying that when a woman comes in during labor, she needs to be dropped off by her birth partner, and she needs to go to see the midwife, be assessed, and then hopefully the birth partner can join her if she is in established labor. So I think it's really important that we bear in mind how vital communication is during this time. When a woman is in labor, it's important that she tries to stay in her zone as much as possible. So communicating information such as how many surges, waves or contractions, whatever you want to call them, how many has she been having, when did she last urinate, when did she last maybe mentioned that the surges were becoming a bit unbearable, or that she's starting to feel some bearing down pressure. When was she sick, if she was sick, if she was throwing up, diarrhea, any changes that you've observed or any changes that the woman has communicated to you as a birth partner, then I think it's really important that I would just write them down on a piece of paper with the times when these changes happened, so that when we get to hospital, I can call the midwives, tell them that we've arrived at the entrance, hopefully hand over the woman to a midwife who will be assessing her, or a midwife on the ward who can then have access to this information without having to ask woman these questions. So if you could have these notes, as well as her birth preferences or birth plan, whatever you want to call it, together at the front of her hospital notes that you would then give to the midwife who's going to assess her. The other tip would be pay attention to how much stuff that you take with you. Wherever you're giving birth, I think it's important to pack a hospital bag. So I would make sure that I pack, you know, when you have like a set of 3 suitcases, just take the largest bag available, because in there needs to be things for the woman in labor, clothes for baby postnatally, things for the birth partner as well. So I would just try and pack everything into one suitcase so that it's easier if the woman has to maybe make her own way to the birth center from the door after you've dropped her off, or even if she's with a midwife, then it just makes it much easier, because you as a birth partner aren't going to be available with your extra 2 arms to carry holdalls or different bags. So ideally, if it's a bag that has some wheels on it, then it's easier to carry. If you've been with a woman in labor as well, you will know that sometimes the shortest distance when a woman is in labor can take a long time, because the surges don't stop, they're still happening. So you might need to be waiting every few steps, breathing through the surges. So one bag is another tip. Another tip for the women in labor is really paying attention with where your focus is. We know about the importance of the mind and body connection. So if you can focus on your breath during labor. We want that breath we want oxygen to be sent down to baby, to be sent to all your organs, not just to your vital organs. The more that you can let the oxygen into your body, the better that babies cope during labor, the better that you will be able to cope. So really try to just be in your own zone. If you can imagine, I don't know, whatever you want to imagine around you, a shield of protection, a light, whatever works for you, but just really take the time to focus on your breath and focus on your baby as well, and try to be in the zone. Try and minimize any unnecessary disturbances, any unnecessary conversation as well. The other tip that I would share is about our sense of smell. Smell is so important during labor and during birth as well. So say, for example, to try and minimize the difference in transition, if you have been maybe using essential oils that are safe to use during pregnancy, lavender is always a good example. So if you've been laboring at home for as long as possible and you've got some lavender maybe on a flannel or on a piece of tissue, it might be a good idea to use that during the transfer to hospital, whether you're in a taxi or you're being driven to hospital by a birth partner. But you can continue to have this as a source of comfort and relaxation if you just have the lavender with you, a few drops on a bit of tissue, and you can just continue smelling this before your birth partner gets there, during labor, even postnatally. That could be something that's really helpful. Another tip actually that I gave to a client recently was maybe wearing your birth partner's clothes. That can be really comforting and reassuring as well. So any familiar smells could be really good to use during labor and during that time when a woman is maybe not with her birth partner. Another tip could be the use of affirmations. I love affirmations. So you could use these, you could write some affirmations. I'd maybe take a piece of paper, say that big or half of that, but it needs to be affirmations that you can write down and you are able to see them in the birth environment. So these affirmations could be, for me, affirmations that work really well are quite simple. It could be an affirmation as simple as, I trust my body and my baby. It could be something like, birth is safe. It could be, everything is always working out for me. So whatever affirmations really resonate with you, I would write them down, or sometimes you could maybe even have them on your phone, and you could wear some headphones and you could have those going around, or using your hypnobirthing scripts as well going around. But affirmations are really, really important. Again, they just bring your focus back onto what's important. They minimize any unnecessary disturbances as well. Skin to skin, of course, that's going to be just as important, if not more important, for protecting mom and baby. Skin-to-skin contact increases the oxytocin that's available. It also helps with breastfeeding, and we know that breastfeeding helps to protect babies from lots of different diseases, from illnesses. So make sure that once you've had your baby, you're doing lots of skin-to-skin contact and you are breastfeeding, as long as you feel comfortable with that. I think it's also really important that we remember that birth is sacred, and that wherever birth happens, this is a rite of passage for you. It's a rite of passage for baby. It's a rite of passage for your birth partner as well. So it's really important that we treat the environment as being sacred. So even if your birth preferences can't be met because of the restrictions to keep you and baby safe, I think it's really important that we try and maintain some kind of sacredness wherever you give birth, and that women and babies and partners are treated with respect during the birth process. The other thing is, I think it's really important to try and get home as soon as possible, of course, to minimize the spread of the virus. So as long as it's safe for you to be at home, as long as you are well physically, of course, then it's much better to be at home as soon as possible after birth. Of course, help might not be available in the same way that it was available before, but please do remember to ask for help. You do not need to go through this alone. It still takes a village to raise a baby. So call for help from family, friends. People might be able to help by maybe dropping some meals off at the door. They don't need to actually physically come in and see you. So as long as the meals are, of course, prepared according to the current safety guidelines, then please don't suffer at home on your own. If you need the help, ask for the help. There are lots of different ways of help that are available to you. There's lots of different things that we can do on video or on the phone to try and help you postnatally, and to make sure that you enjoy the time getting to learn your baby, getting to learn yourself as a new mom, whether it's your first or your fifth child. I think it's really important that we try and maximize the amount of joy during this time. Okay, thank you. Bye.